Thanks for tuning in to Health Advocates Ask the Expert series, our monthly show about trending topics in healthcare. I'm your host, Courtney Preiser. Today we welcome Amy Kinsley, a nurse and senior personal health advocate, to talk about employee use of the emergency room, which can have a big impact on healthcare costs for both individuals and their organizations. Amy has over 15 years of experience as an ER nurse. Thanks so much for being here.
Thanks, Courtney. Good to be here.
To start with, what are the pros and cons for employees of using the emergency room versus, for example, urgent care?
So some of the pros of using urgent care as opposed to the ER is you're not going to have some of the lengthy wait times that you'll experience in the ER, especially when there are times of like the flu, for example. You don't have to sit with your minor illness or injury in a waiting room with 50 people who may have some really communicable diseases that you don't need on top of your sprained ankle.
Absolutely. So then, when should alternatives to the ER be considered?
One of the rules of thumb I go by, and I often tell my members, if you're thinking about going into the ER simply because my doctor can't see me today, alternatives should be considered. And we can help find in-network care, for example, urgent care, like we just talked about. And we also help if they're on the fence still about what our recommendation may be. We can call with them to the doctor's office, the provider who knows them, to get their input. And then a lot of employers do offer telemedicine, where they can get on their computer or their phone and speak to a doctor who's board certified and not have to leave their house even and get care that they need.
Super convenient too.
Very.
So how can an individual's choice of where to go when facing an urgent issue impact employers? What are the cost implications for the larger organization as a whole?
So ER visits are typically much more expensive than a provider's office visit or urgent care. And it affects the employer's bottom line, and really it does for the patient as well. Because as we all know, there are a lot of consumer-driven health plans out there now with high deductibles. So it's making better use of, for example, your HSA dollars and your deductible. It does affect the bottom line for both patient and the employer.
It can be a trickle-up effect almost.
Correct.
Yes.
Yep.
So then why is it so important for organizations to educate their employees about thoughtful use when it comes to having an urgent issue?
I think it's important because of a couple of things we mentioned, but also sometimes people don't even realize there are alternatives. They think, well, it's 4 p.m, I'm in a lot of pain, I have a sore throat, I go to the ER. So that's a lot of things that are new now, relatively new, urgent care, telemedicine, they don't know.
I see.
So if you don't know, you're kind of powerless to be able to explore other alternatives. And I know that employers do send out email blasts letting them know about our services, and it's our goal to get the right care for the patient in the right venue.
Absolutely. Because sometimes the ER is appropriate, but other times they can probably go somewhere else.
There are certainly times when, ER is definitely the appropriate place to go. Unrelenting chest pain, signs of a stroke, mouth drooping, trouble speaking or swallowing, uncontrolled bleeding. There are times when the ER is absolutely the most appropriate venue. The issue is when you go there and you don't need it, the ER does triage, and the sickest people are going to be seen first.
Rightly so.
So, which is the way it should be. And if you're there with a minor illness or injury, you're waiting in a waiting room with 50 people with possibly communicable diseases, and you don't want to come in with one problem and leave with 2.
So how does Health Advocate help organizations educate their workforce about, this issue of using the emergency room?
Well, certainly the members can call in and speak to one of our registered nurses. They are sent out email blasts to let them know about the different things that we offer. Some of our clients have nurse line services, so we actually talk in depth about signs and symptoms, and although we're not directing medical care, we are able to point them in the right direction. Some of our groups, if they don't have nurse line, they do have a 24-hour nurse line with the carrier, and we will warm transfer the patient to the carrier to get a nurse on the line that can give some treatment advice as well. And the other thing a lot of employers are starting to offer more and more is telemedicine.
Oh, great.
So again, for minor illness injury, telemedicine is a nice portal and convenient. You don't have to leave your house. and speak with a board certified doctor about whatever illness they're having.
Save time and get the care they need.
That's right.
And that's all that matters, right? Right care, right time, getting them what they need.
Right venue.
Absolutely.
That's right.
Well, this has been really helpful. Thank you so much for joining us.
Thanks, Courtney.
And thank you for tuning in. If you like what you just heard, you can follow us on our social media pages or subscribe to our channel below. And join us again next time for another edition of Ask the Expert.